Hello, I'm Dr. Judy, and today I'll be discussing rabies. In the United States, actually human rabies is very rare. Only 39 cases have been diagnosed since 1990, but between 16 and 39,000 people are treated each year for possible exposure. Rabies virus causes inflammation of the brain and spinal cord, resulting in death for all warm-blooded animals, including humans. In humans, the most common route of infection are bite wounds. When bitten, virus-laden saliva enters the body and travels along nerves to the brain. No signs of disease are exhibited prior to the virus entering the brain. This incubation period most commonly lasts 1 to 3 months or longer. Rabies virus in the brain multiplies rapidly and spreads to the salivary glands. During this period, animals exhibit signs of abnormal behavior: salivation, aggression, disorientation, death. The infectious phase usually lasts 3 to 7 days. Death is usually 100% in an unvaccinated animal. Note, infected animals cannot transmit rabies virus to other animals or humans until the virus is present in the saliva. Wildlife most commonly infected include raccoons, skunks, groundhogs, bats, wolves, foxes, coyotes. Domestic animals most commonly infected: cats, dogs, ferrets, cattle, rarely horses. Rabies is not common in squirrels, mice, rats, guinea pigs, chipmunks. These animals have not been known to have ever caused a case of rabies in humans. Rabies is an uncommon disease in domestic animals. The majority of rabies cases occur in wildlife. Rabies vaccinations are given to protect our pets from acquiring rabies from wildlife, preventing transmission of this disease to humans. The rabies vaccines administered by veterinarians are a killed vaccine and cannot cause disease. Veterinarians maintain strict records. We certify the duration of vaccination as 1 or 3 years. Animals can be vaccinated for rabies as early as 3 months of age. To produce maximum vaccine titer, animals with no known vaccination history, regardless of age, should first be vaccinated for only 1 year duration. When boosted in 1 year, vaccine for a 1 or 3 year duration may be used. Accepted rabies guidelines of the Public Health Service for our cats and dogs are: if our dog bites a person or another animal, a healthy vaccinated dog is confined for 10 days for observation of behavior consistent with rabies. At the end of this 10 days, if there are no symptoms, they are released from quarantine. We should note at this time that no person has ever contracted rabies from a vaccinated animal held for the mandatory 10 days observation period. Healthy unvaccinated dogs are also quarantined for 10 days and a rabies vaccination is administered. Dogs exposed to rabid or suspected rabid animals not available for testing are, if vaccinated and healthy, they are revaccinated and isolated for 45 days. However, unvaccinated healthy dogs exposed to a rabid or suspected rabid animal, the recommendation is euthanasia and tests for rabies. Second choice, strict isolation for 6 months, vaccination on entry, or 1 month prior to release. You now know that rabies vaccinations are not just to protect our pets, but people too. Remember, pets are family too.
Down the Road is brought to you in part by Prince Agra, makers of Omnigen AF, advancing animal nutrition for healthy animals, and Woodruff Enterprise of Springfield, Ohio.